Hello, my name is Michelle Spencer, and I am a graduate student at the University of Texas at Austin in their Doctorate of Nursing Practice program. This is my presentation of the review of the literature. With the recent 2020 COVID-19 pandemic, medicine had to switch rapidly to telehealth. Telemedicine has been around for decades, but has never been utilized in nursing programs or education. Now that telemedicine is used more frequently since the pandemic, it is time to start implementing curriculum programs that include telemedicine. Virtual healthcare is here to stay as it provides outreach to urban and rural areas. We want to make sure that we continue to use telemedicine, but we use it in a safe, ethical way that supports our patients and provides safe and best outcomes. This leads to my PICO question. Does including telehealth in undergraduate and graduate nursing curriculum compared to a traditional program improve a registered nurse and an advanced practice registered nurse virtual patient care? The aim of my project is to better understand telehealth curriculum and its effects on the registered nurse and advanced practice nurse, but also to make sure that we have objectives that are streamlined and easy to implement for nurse faculty into the curriculum. Rutledge has created studies since 2021 and developed the 4 Ps of telehealth, which include preparing, planning, providing, and performance evaluation. We will talk about this further on. That was one paper I had discussed, but this is a review of the literature. So the methods that I used started with 4 different databases. I looked at PubMed, Clinical Key, CINAHL, and Inspect. The search terms that were used were curriculum on telemedicine or telehealth competencies or telehealth curriculum, and curriculum or Doctor of Nursing Practice curriculum or nursing curriculum, and graduate level nurses or undergraduate level nurses. The results shown here are what each of these databases provided on this initial search with these search terms. I then put the information into the Prisma flowsheet of 2020. I have my 4 databases, and with those keywords, PubMed established 7760 articles. Clinical Key had 2,000, CINAHL with 55, and Inspect with 148. I was able to input these articles into Zotero, which helped eliminate the duplications, eliminating 29. I further eliminated 8,000 articles by eliminating any articles older than 5 years old. I decided to go with the most recent 5 years to encompass, since the pandemic, what has been implemented into curriculum in regards to telehealth. Once those records were eliminated, PubMed was left with 15 articles, Clinical Key had 1,749, CINAHL with 35, and Inspect with 55. Then I was able to further exclude articles by hand through going through their abstracts and titles. 473 articles were removed as they were found to not be curriculum focused. 447 were not telemedicine. 431 were simulation, and 426 were a wrong curriculum setting. This left me with 10 articles from PubMed, 34 from Clinical Key, 25 from CINAHL, and 8 from Inspect. I was unable to retrieve 3 articles, and so I was able to go through 74 articles in depth. I did eliminate 18 articles at this time due to not being curriculum focused. 19 were not telemedicine, and 11 were wrong curriculum setting. This left me with a total of 23 articles to include in my systematic review. Because there were multiple articles in the systematic review, my evidence summary table might look a little messy here. So I will scroll through and discuss my results here. The articles, most of the articles utilized an implementation of a telehealth curriculum through didactic courses such as lectures or modules. They also included an experiential learning environment or simulation. Some required or offered telehealth clinical hours. Most did not. Some of the articles, a few of the articles focused on faculty and making the implementation easier for faculty. Routledge was utilized in multiple studies, utilizing the 4 Ps: preparing, planning, providing, and performance evaluation. Chaikey-Harris also developed the iSOAP in 2021, which is a form of the SOAP note to help document and assess your patients virtually, safely. The quality of my assessment was good to medium quality articles. Most of them were qualitative based, as we saw how the students reacted to the implementation of telehealth care and how that helped them prepare for graduation. Most were quality improvement projects, and then few were randomized controlled trials. Outcomes include statistically significant outcomes, which means that telemedicine in curriculum does improve students' preparedness to be delivering telemedicine in their career. We also concluded that the 4 Ps and the iSOAP help implement telehealth education into the curriculum and help faculty prepare this for their students. This is important because this prepares students for telehealth in real life. It also helps provide resources for faculty so that they can develop and implement a telehealth course into their nursing curriculum. It is important to prepare nurses through objective telehealth competencies. This will make sure that nurses and nurse practitioners are delivering safe, ethical, and effective healthcare across the line. one of the research studies also opened the possibility of interprofessional collaborative education through a telehealth curriculum as well. So to answer my PICO question, yes, a telehealth curriculum does improve the competencies of RNs and APRNs in telemedicine. There is ample amount of research in graduate programs that have developed and implemented competency-based curriculum into their curriculum. There is more research required for undergraduate implementation, but it has been seen through the articles that using the 4 Ps and ISOAP is potentially able to cross over, but the research is still required to verify. Next steps, I plan to use the 4 Ps and ISOAP to develop a 1-hour elective course. I plan to implement this course throughout different levels of nursing curriculum, in a traditional BSN program, in an accelerated BSN program, and a DNP prepared FNP program. Once the program would be offered as an elective, it would be free to the students and not count towards their grade. The students would voluntarily join the course, but the evaluation would be, I would like to evaluate all the students in the program. So my plan would be that there would be an evaluation at the end of the course through an OSCE delivered exam, an objective structured clinical exam, an OSCE, that would utilize a telehealth visit with an SP. And we would evaluate the students objectively there. And this would include evaluating all the students, even the ones that weren't in the course, to see how the students in the course compared to the students that did not take the course complete in this telehealth OSCE. Once the implementation is complete and the evaluation has been done, I will gather my data, write and publish, hopefully, and then prepare a potential poster or podium to present at a convention or conference. Why is this important to nursing? Why should we care about telemedicine? Well, telemedicine is going to continue, and we want to make sure that future nurses know how to use telemedicine. There are ethical implications and safety issues. So we want to make sure we're developing safe and effective care. Telemedicine is great. It's available healthcare to those in rural or even urban areas that cannot get access to healthcare. We also want to make sure that we are documenting appropriately and safely and appropriately billing and getting compensated for the work that we are doing. Telemedicine also opens the doors for increasing interprofessional collaboration and making it potentially simpler to include interprofessional collaboration directly with the patient. And also, this is important because we want to help our nurse faculty develop these courses. We want to make sure that the 4 Ps and the ISOAP is available and understandable and easy to use, so nurse faculty can implement this into their programs. That is the end of my presentation, and these are the references that I used. Thank you so much for your time. I appreciate you. Thank you.